Good day, everyone. It's wonderful to be here. I come from a country, Nigeria, that contributes 28% of the global maternal death. Daily global maternal death of 800. Ladies and gentlemen, that means 224 maternal deaths occurring every day in Nigeria. I still see women pouring out blood like a tap following a childbirth. I still see women present with dead babies in their womb, having been in labor for 2 days. I still see women mourning the death of their babies, incontinent of urine, ashamed of their offensiveness, and abandoned by their family. I still see women convulsing, having eclampsia, which is purely preventable with access to quality antenatal care. I still see women crying. I still see children crying in the pediatric emergency with conditions that have long been eradicated in some countries by immunization. Currently, we have an epidemic of diphtheria in Kano, Nigeria. I still see healthcare workers exhausted, having to care for patients, even though they are burnt out due to poor or inadequate healthcare providers. I still see healthcare workers struggling with inappropriate and inadequate facilities and commodities to care for the vulnerable women and children. We have continued to see inequalities to achievement of universal health care that aim to have no one left behind in accessing quality health care services. There is no doubt that we are losing at halftime. But we now have the opportunity to push to ensure we win this vital match in the second half. I'm optimistic that winning in 2030 is possible. We have 146 countries that have met or are on track to meet the SDG target in under 5 mortality. There are great learnings from countries that other countries can leverage on. We have seen leaders and policymakers in some countries that have exhibited great leadership and accountability skills towards ensuring adequate investment in healthcare services. We have initiatives such as Align MNH, where the maternal and the newborn health communities have come together and collectively are ensuring that mothers and babies do not only survive, but thrive. We have seen researchers that are working very hard to find new treatments and new innovations to address the leading causes of maternal and under 5 mortality. We have E-MOTIVETrial demonstrating the use of the E-MOTIVE bundle. Dr. Anita just mentioned it, which can reduce postpartum hemorrhage or severe bleeding by 60%. We have the IVON trial that has demonstrated the use of new treatment for anemia in pregnancy. We have the STEPMAC trial trying to assess simplified method of treating eclampsia so that we can improve access to care for women in low-middle income countries. We've seen ACTION trial assessing the use of steroids to reduce morbidity and mortality of preterm birth, and on and on and on. Your Excellencies, ladies and gentlemen, the solution to winning at the end of the match, they are obviously with us. 1, commitment to our leaders, holding them accountable to ensure adequate investment in healthcare. Number 2, collective action, ensuring together we are committed to achieving quality, equity, and dignity for women and newborns and children including universal healthcare access and leaving no one behind. Thirdly, supporting researchers to continue to develop new treatments and innovations, and importantly, ensuring that these new treatments and innovations reach those that require them, which means every mother and child that requires them. Ladies and gentlemen, the second half is about to start. Let's decide collectively that the lives of our mothers and children are worth saving. Thank you.